What's up, guys? So, I wanted to make this video today because of this one single Forbes article, but there's other stuff that goes along with it. So, the concept that I've been swirling around in my head for a few days now is that there is a similarity between aspects of the CV that is starting to kind of come together for me. I was like half asleep last night. I didn't get any sleep last night, like at all. And I came home and I was getting like 30 minutes maybe. And while I was sleeping, I don't know if, because the television was on, so I don't know, it might be some slogan some new company has or something, because it sounded like it was the television saying this, but I don't think it was. The masks, the apps, the vax. Those are the three things I've been tossing around in my mind for a while now. What do I mean? The masks, the apps, the vax. Well, they have a lot of similarities. And the most striking similarities, there's two. The first one is that they're enforced through peer pressure, social pressure. And the second one is that they're not effective unless a lot of people use it. These two things are both true with the masks, the apps, and the vax. Now, I think most of this has been about the vax, but it's not just the vaccine either. It's that totalitarian two-step I was telling you about whenever we first were talking about, is the CV coming to the US? And I was telling y'all, yeah. The first thing that hit the United States, right, was the masks, the mask mandates. And we were told that they weren't effective, but okay, they are effective, but they're not effective at keeping you safe. They're effective at keeping everyone else safe. You have a moral imperative to do it. And if you don't, there's a subsect of people in your life that are going to disavow you, treat you like crap, say that you're subhuman, that you don't care about grandma, etc., etc. Around the time this was happening in the US, I was making a video about the health tracking and restriction apps that we were seeing in Wuhan and Russia specifically. Singapore had like a kind of version of it. But they tried, at the time I was reporting it, they were trying to do it anonymously. In Wuhan and in Russia, it was absolutely not anonymous. They were forcing people to use the app. Forcing them. Okay? The thing about it is, the apps here, the way that they're being rolled out, it's not requiring people to use the app. It's also not requiring people who use the app to keep the app open. But what we're about to read in this Forbes article is it's not these health tracking apps. They are ineffective if anywhere less than 75% of cell phone users are using them and have them open in the background in their phone. So all these health tracking and restriction apps that they're throwing at us here in the next couple of weeks, they're not effective. Unless you darn Americans, you guys you're just too darn free. We're going to have to force you to download the app because you don't want to take everybody else's health into account. You're being selfish, right? And they have new versions of these health tracking and restriction apps in schools so that the schools could reopen. For the kids that don't have phones, they have little Bluetooth cards that they hang on a lanyard. And if they stand too close to somebody, it sends off a red light, warning them that hey, you're too close to Timmy. There's some states that are already looking at mandating this system. And some places where people work that are also thinking about mandating this system. So, the mandating of these apps first started in school and large corporations. What else is like that? Right. You can't go to school without your vaccines, right? Now it's going to be you can't go to school without your vaccines, your mask, and your app. Now, theoretically, if the apps that they're making and they're putting out, and one state's already put one out, and a couple of them have actually, but nobody's mandating people use them yet. They're completely useless unless at least 60% of the population, which is like 75% of cell phone owners, are running the app, which is never going to happen. So why are they doing this if that's never going to happen? Furthermore, leaving the data anonymous basically prevents contact tracing through these apps. So the way that they're proposing that they're going to roll this out in the US, it doesn't make any sense on its face because they're not going to work. Unless, well, isn't it funny that Apple and Google forced us to download the infrastructure for this type of app like 2 updates ago? I got into a big, huge argument with AppleCare. I literally got booted off for making too many comments. Because AppleCare's argument is, if you don't want to download a contact tracing app, then don't download a contact tracing app. And my argument was, I don't want my phone to be able to download a contact tracing app. I don't want a contact tracing app to be capable of working on my phone. And that was when my antennas first went up. Because if you're not going to make me download the app, why are you making me take the infrastructure? And there's this whole little business sector popping up around Bluetooth tracking technology. It's not just for the CV. There's actually a bunch of ways you could take this Bluetooth technology and make use of it in ways that it's actually kind of surprising. It's been around for a long time and they haven't used it for these ways yet. I'm speaking of like how close you are to another person. Bluetooth can tell you a lot. So I guess my point is I'm gonna be worried if they mandate these apps. I hope there's not a single state that mandates their citizens download this app or wear the lanyard, because in Russia they either gave phones to people who didn't have phones or they had this alternative thing I'm talking about. I'll show you in a minute. Because if they're bringing this in now and they're really going to put all this money into it, it's not effective. So why are they doing that? Well, if their intent is to force us to download it, then it could be effective. No bueno. No freaking bueno. Because the same thing is true about vaccines. Unless a certain percentage of the population is vaccinated, they're essentially ineffective. It's not an effective medicine unless a lot of healthy people take the shot. And even then, you're gonna prevent some people from getting it, but there's no guarantee that you're gonna be preventing old people with comorbidities from getting it. There's no guarantee that you can protect the at-risk category of people unless you have massive vaccinations. Massive. So the same thing strikes me about the vax. The vax comes in, they say it's not mandatory. They tell us that they've got the infrastructure built to put the vax out quickly, have it quickly manufactured and quickly distributed. I believe somebody mentioned the military. So just like Apple and Google 3 weeks ago, they're telling us, we've got the infrastructure for this. And it's like, I mean, you can have that infrastructure. Guarantee you 70% of the American population wants nothing to do with this vaccine. And that includes a lot of people who are not anti-vaccine. That includes a lot of people who probably go every year to get their flu shot. This CV vaccine, this mRNA vaccine, to anybody who's done their research, is a never before tested vaccine that has skipped animal testing and is already being tested in humans. And what's different between mRNA vaccine and the vaccines that we used to take? It's complicated. Suffice it to say that old vaccines used to put something inside of you that would cause your body to have a specific reaction to it that would create the antibodies to whatever you were being vaccinated against. That's the theory. All right? You guys be easy on me. That's the theory. This mRNA vaccine, well, they're not going to put anything inside of you to cause an immune response. No. They're going to go in there. They're going to alter your DNA so your body creates the antibodies without having to react to anything. They're going to, as the gentleman put it, they're going to rewrite the software of the human body. And there's people who jumped at the chance to get this stuck in their arm. It's crazy. There's a large majority of people who are not going to take this vaccine. They're not going to want to take it. Just like there's a large majority of people who are not going to want to download this health app. Just like there's a large amount of people who are not going to want to wear a mask. Most of those people are wearing masks now. They haven't downloaded the app, but they didn't do anything when Google and Apple put the infrastructure on their phone for the apps. And I'm just telling you, if we hear that they're going to start making us download these tracking apps, ooh, the vax is coming next. That's what I kind of came to. Currently, it's just peer pressure, social pressure that makes people wear masks. And that's been really effective. It's always been peer pressure that have people take the vaccines. It's the only medicine in the world where a doctor asks you, take this medicine so that somebody else cannot get sick. Perfectly healthy individual, I need to inject you with this so that person X, Y, or Z doesn't get the flu. That's why it's called a biologic instead of a medicine. And healthy people don't need medicine, so how are we going to give medicine to healthy people? We'll call it biologics. I've been trying to avoid this topic of the vax, but this is unavoidable at this point. I'm seeing a pattern, and whenever I see patterns, I point them out. The masks, the apps, the vax. The quicker you see people become okay with the first one, you'll see the second one rolling out. And if you don't believe me, let's just look at schools right now. Because remember, schools were the first place you couldn't go without being vaccinated, right? It was the testing grounds for mandatory vaccination. Well, let's see how kids are going to have to go back to school now.
And Manila, that's why these school systems are looking into this technology of a contact tracing system with students. But one big question being asked, as always, how much privacy are you willing to give away for the safety of others? Right now, we only have one school district in the country that says they're going to try this, and it's right outside of Columbus, Ohio, where they have about 4,800 students in 5 different schools. Now, the company Volun, which sells what look like little remote controls that are actually connected to the school system via Bluetooth, they can also send out alerts and even track each and every student, but only when it's on campus. Then you have another company that even businesses are looking into, where you would wear a smart Bluetooth badge that not only track your whereabouts, but also it lights up if you are too close to a coworker. Now, many of these surveillance companies not only are creating an app you can download on your smartphone, but for, let's say, a little kindergartner who most likely doesn't have a cell phone yet, well, they would actually be required to wear these devices. And Manila, it's one of these things where, looking into this, you have, as far as one school that has already implemented a tracking system, it is Syracuse University, where you're using the Spotter EDU system that actually was originally used for just taking attendance in class. But now the company actually has added a COVID-19 contact tracing system to its platform, which the school says has helped in pinpointing when and where students will actually congregate in large groups to eventually go and break them up and continue to monitor those areas. Now, as far as how the students feel, Manila, many say that they didn't even like the system when it was strictly used just for class attendance. Now, this adds an entirely new layer in just how intrusive technology can get in the crisis of COVID-19. Manila?
Essentially, this is like supposed to be a contact tracing app, but when it comes to kids, especially little kids, I mean, this is a whole different level of privacy, right?
It really is. And basically, as I listen to Farron's report, I don't like any of this, right? Every single thing that I'm hearing so far, it indicates, number one, that you're giving away privacy. If you're a parent who's a part of this and you allow your child to go, your kid is going to be tracked. You have companies that are essentially trying to make a lot of money off of this because they know that there's a huge market of young kids who won't necessarily carry around smartphones. And so you can essentially put these bracelets, Bluetooth-enabled bracelets, on children, and you can track their whereabouts. The problem is this. is that even though the WHO says, yes, kids can spread, and there's even an article last week that came out saying that kids are super spreaders of some kind, the reality is that kids, yes, are going to contract it, but they are not the ones who are most susceptible to it. And while other people may be, the reality is you don't get herd immunity until there is some form of COVID going through the population. So if kids are the least susceptible, they would actually be the safest to help build herd immunity, but that's not being discussed at all right now.
Oh, I'm with you on that. I hear you. I've seen and heard many studies of Nobel Prize winners in the sciences who have discussed this, and they have said the same thing, that they say with children, especially by age, we can't just lump all students. College students are not the same as elementary school kids, but it's much safer for these younger children. But speaking of safety, there is, as a mom of a little one, and you have kids, the other safety concern, Ben, is, how safe are these beacons? I'm sure it's got to be possible to hack them, or someone other than the school, they're going to be able to track these kids' locations. We had problems with, when Instagram first started and young kids were posting their GPS location and predators were able to locate them.
That's right. And this is the reality that we have to remember, is that whenever we're talking about any kind of technology at all, if you as a company are able to track the location and the contacts, the whereabouts of a student, then any hacker can as well once they get into your system. And hackers will be able to get into these systems. Make no mistake. How many times, Manila, have you and I covered stories where these companies gather a lot of data, hackers get into that data, and then they either abuse it or sell it off to some other group in some way. And so the reality is that if a company is able to track your child's location and their whereabouts, then a hacker can too once they get into your system, and they almost undoubtedly will be able at some point to get into those systems.
And Ben, how widespread do you think is going to be the use of these tracking devices? Not just in schools, but I think they're spreading into offices for adults like you and me.
They are spreading into offices. Look, there is a cottage industry that's kind of popping up right now of businesses that are really pushing for contact tracing because they know that there's a way of taking kind of existing technology that's really underused right now and creating kind of a boom market for it right now by transferring it over to contact tracing related to COVID-19. One thing that's incredibly important, though, to remember is that contact tracing, for all the things we don't know about COVID in terms of how many people have had it, how many people in the society have antibodies in their systems, COVID tracking will not, and contact tracing will not actually be able to be effective at this point. And there's been a number of studies that have been done on this so far because of the fact that we don't know how many people already have it. When you have a brand new disease like an HIV and it's being transmitted sexually, it's much easier to run a contact tracing program, not with were you in the same rooms, same shopping center, same grocery store as these other people. COVID is far too widespread in society to run a successful contact tracing program. No question about it.
Ben, can you imagine the types of discrimination that can come from this when people find out, they're going to treat someone like, they have leprosy, right? This is, people are mean to each other.
Something wrong.
Right.
Yeah, they've done something wrong. Like you are the bad person who went out and got COVID.
Right.
That seems to be the attitude right now.
Right, and that's, to me, something that's a little terrifying for our society and for kids to grow up in, is to not only fear, stranger danger, which we know is usually not the case anyway, but now to fear every human being because they might have some disease that kids can't really fully grasp at this time. But now it's pitting people like you and me looking at one another who've known each other for years going, oh, I don't know. Is Ben going to give me a disease?
Yes. Can they be trusted?
Can
they be trusted? And the other reality is that that's a lot of what the argument about people wearing face shields and face masks is, that we're creating additional physical and social barriers between people. And there's a lot of questions about the long-term effects that that's going to have.
Oh yeah, Ben, that's a whole different conversation for you and I to have about the social impacts long-term. And I'm sure we will talk about it because I think this is going to go on for quite a while, maybe after November.
Let's read. This author, Zach Doffman, just by reading the verbiage, the way he writes, he's clearly very pro-app. Okay, that's a new category I'm making right now. It's not pro or anti-vax. He is pro-app, and I am anti-app, I guess. Apple and Google CV tracking apps, now on US phones. Contact tracing apps built on Apple and Google's inbuilt exposure notification framework. That's him saying Apple and Google just put the backbone for any contact tracing app on your phone permanently without asking you in the last update. Have finally reached America. Virginia was the first with COVID-wise, followed by Alabama, Arizona, North Dakota, and Wyoming, which have launched their own variants. The latest reports suggest that perhaps 20 states will introduce similar apps, able to reach around half of the population. But they won't really reach half the population, nowhere close. There's a fatal flaw with such contact tracing apps, as America is about to find out. Such Bluetooth tracing apps, which essentially detect and tag other phones with the app in their vicinity, in case a user tests positive for the CV, originated in Singapore and then took a foothold in Europe, which is a blatant falsehood. They originated in Wuhan, moved to Russia, and then Singapore. I guess the way he's differentiating this and pulling it apart is because Singapore tried to start theirs like ours, anonymous. Wuhan and Russia, there was never any anonymity to those apps at all. And I don't believe there's going to be any anonymity to any of these apps, and they'll be hacked. But I don't understand how he could just blatantly leave out the fact that they were used in Wuhan, Israel, and Russia to almost a totalitarian level. That's not a good look, though, I guess. He really wants you to get the app, so he's not going to say that. Originally, the idea was that apps would capture enough data to identify local infection hotspots and even contextualize contacts, sitting on a train versus queuing outdoors. But then Apple and Google stepped in with their privacy-first framework to stop governments and health agencies gathering any such data. And he's mad about this now. He's mad about this. Compliant apps can tag the anonymous identity of a nearby phone, nothing more. There is no location or personally identifiable information captured. As I've commented before, I'm sure you have, this is a major issue and seriously diminishes the potential benefits of such apps. Yes, none of us want our governments using these apps as a backdoor surveillance platform, but haven't we now enough proof that our phones don't need contact tracing apps to betray our movements and behaviors anyway? Oh, wow. So the argument is you are already so surveilled like a rat in the cage. Just take this extra. Shouldn't we give the health experts what they say they want? No, we shouldn't give the health experts what they say they want. Learn how COVID-Wise, the nation's first exposure notification app, which launched in Virginia earlier this month, can help save your life or somebody else's. Anyway, you can put that argument to one side. It's not the critical issue here. The reason such apps fail is that there are not enough of us willing to install and use them. And that doesn't just mean downloading the app. It means keeping the app enabled and running, perhaps for many months, and then adhering to every one of its instructions to isolate or get tested. Except you won't receive many such instructions because not enough people use the apps. You can see the problem. It's pretty fundamental. I'm sorry I'm laughing at this guy, but it's just like I could write this and I would be completely trolling. And yet this guy is dead serious. The other issue with prohibiting personalized data linkage or collection is that health authorities cannot mandate or enforce or even track isolation or testing. You can't link apps to a right to work or travel or access entertainment venues. Doing so would be dystopian, yes, but also highly effective alternative to broader lockdowns or closures. And so here we go. As a product of the this or that, of course he's going to offer us a this or that, and here it is. Take the app, or you're locked down forever. Is it not better to sacrifice some individual freedoms on our phones, which already track us extensively, rather than the economically damaging alternatives? You mean like just going back to work? That sounds really economically damaging. Fast forward 6 months, and in the event of widespread second waves and the backlash from populations that need to work to earn to live, this debate will return. And he's so hoping. He's like rubbing his little gross hands together, just like hoping that this argument comes back to the forefront. Back when the apps first started to gain prominence, I reported that data scientists believed around 60% of a population would need to install and use such apps for them to be effective. That equals to 75% of smartphone users in most places. To put that into context, it's similar to the install base WhatsApp enjoys in its most popular markets. Again, you see the problem. It's pretty fundamental. Anyway, it now turns out that the situation is even worse. The latest research published this week suggests that even under optimistic assumptions, which is defined as 75 to 80% of smartphone owners installing an app and 90 to 100% of the users adhering to advice to isolate or seek testing, quote, there is insufficient evidence to justify reliance on automated contact tracing approaches without additional extensive public health controls and measures. And it's those physical public health measures that actually work. We can't see it as a silver bullet, the lead researcher from the University College London told the Financial Times, despite governments suggesting during initial lockdowns that this would be a panacea that would enable us to get back to normal and forget about COVID. And if they could get this right, it would solve all of our problems. Let's return to Singapore, where the innovators behind the original CV Bluetooth app quickly found that it was not effective on its own. The comparatively compliant population has seen mandatory location check-ins in a multitude of entertainment venues, workplaces, and health facilities, as well as physical tokens introduced to supplement its app. And those places that have done the best at containment have used effective manual contact tracing and/or much more intrusive measures. Anyway, he starts like every other paragraph with anyway, which I have to admit I say that a lot too. But anyway, all this will be immaterial. The U.S. is not going to see the take-up it needs to automate contact tracing. Polls suggest installation of and adherence to such apps in the U.S. will be way less than is needed, probably less than even Europe. Even Germany, where take-up is seen as a success, there are only around 20% of the population with the app. It's going to be lower here, but 20%, if it has to be at 60 to be effective, then why did they put all the money into getting 20%? Did they not see the polls? Did they not think people were... what is it? They thought they were lying to the pollsters? Maybe just all polls suck? But if it has to be 60% to be effective, and you run a poll, and it says, maybe 20% will be open to it, and then you put all this money into making this app, it makes no sense unless there's a plan to mandate. It's the only way it makes sense. And I'm not saying it has to make sense. It could just be dumb. And the less effective such apps are in reality, the less willing people will be to install them and keep them running. It's a vicious cycle. It needs a rethink. If contact tracing apps are to work to make a sizable contribution towards reducing infection rates, then we need a further debate on the balance on privacy and efficacy. We need to decide if we're willing to mandate installation and adherence. As much as we might dislike the implications in optics, we need to determine how to link such apps to QR codes that provide rights to travel and access to locations where we risk infecting others. None of that will happen until we know what shape the impact of the virus takes from here. But you can expect this debate to spiral in the coming months if the infection patterns now emerging in Europe and elsewhere continue. So you see the way that this man thinks. He wants it mandated. Not only does he want it mandated, but see that when he started talking about the QR codes, that's exactly what I was talking about when I made that episode about the health tracking and restriction apps. Those people in Wuhan had a QR code either on their phone or they had to print out a page, and you got a red or a green light, and if you got a red, you took your butt back to the house. No options. This is what he's asking. This is what the writer of this article would prefer. And doesn't this feel like the exact same push towards vaccines? Americans not willing to help. They're not as, quote, compliant, like this guy said. We're not good, docile, compliant little worker bees. So it's not going to be effective unless we mandate it. Okay, well then it's not going to be effective, right? If these apps are not going to be effective unless 60% of people are using them, and there's no way in hell you're going to get 60% of Americans to use it, then let's take that money and put it somewhere else. Unless you have a plan to make 60% of people use it. And just like the mask and just like the vax, if you don't get the app, then you hate grandma. It's so bizarre to me that people cannot see this. This is wild. Because this is the first call for mandatory app downloads. It was already on my radar when they forced the infrastructure into the updates. When they put the app infrastructure in the updates, I knew that something was going on. And there's another market that's going to pop up from this as well. And if you think that they're not gaining anything by putting this infrastructure on your phone, you're dead wrong. They're going to use this technology in a new way. So that's why they had to rewrite the infrastructure on the phones so that these new apps could come in and take advantage of Bluetooth being used in this manner. So the second they mandated that, I was like, well, they're going to make me download the app eventually, I bet. They never had to really mandate countrywide the masks. There was such peer pressure, such social pressure placed on people who didn't want to wear the masks that they got enough people to wear the masks to make them effective. Again, just like the vaccines, everybody doesn't have to wear a mask. But if you get a certain amount of the population wearing a mask every time they go outside, you get a little bit of effectiveness. They didn't even have to mandate it. You put a few short videos on social media of people being accosted for not having a mask and people being embarrassed nationwide. And then the social shame just trickles down through Twitter and Instagram to everybody else. And then the next thing you know, you look outside and everybody you know is walking around with a mask outside. You're like, dude, you're outside. I'm a little bit concerned about how this is going to go because I feel like it's the mask, the apps, the vax. Obviously, in that order. They've rolled out the mask completely. I just caught you up to where they're at with the apps. They're getting ready to start dropping a bunch of individual apps because they've already installed the infrastructure. And keep in mind, there's not just one vaccine either. So they've got this infrastructure now already built to mass produce massive amounts of these vaccines, and they're going to use the military to do it quickly. But only if you choose to. That sounds so much like Google and Apple, we're going to put this on your phone. It's going to be infrastructure. You don't get a choice. But if only you only have to take the app if you choose to. They're going to be like, listen, it's not mandated to download the app, but if you want your phone to stop telling everyone you hate grandma, you're going to have to download the app. Sorry. Like, what is coercion? When we talk about the government's going to force vaccines, they could just do it kind of like they did the lockdowns, where it's like, you don't have to stay inside, but we've literally closed everything and you have no reason to go anywhere. Have a nice day. You don't have to enforce a lockdown then. It's the same thing with the vax. They're going to be like, listen, the vaccine's not mandated, but you can't work or pick your child up from school or eat or breathe unless you take it. And I was in the group for a really long time. There's going to be enough ready and willing participants. There's enough people walking around at this point that I can tell are going to be jumping at that vaccine that we won't need to take the vax. They're not even going to have to force us to take the vax. It's kind of like the Dershowitz argument in the RFK Dershowitz back and forth. We at least both agree that forced vaccinations should be a tool of last resort. When they said that, I just wanted to jump in the screen and be like, no, they should not be a tool. Forced vaccinations, that should not be in the toolkit. Break in case of emergency. No. Because it's going to cause more issues than it solves. It's like you have a fire in your house, you break the firebox, and you turn the hoses on and it shoots out gasoline. I don't know, guys. We'll see. I don't think that they have enough social support, that not enough of these people who are plugged right into the matrix. There's definitely enough of those to get the people on the fence to go out and wear masks. That's clear. I've seen it. I don't think there's enough of those people who know enough about the apps for them to apply that same social pressure. So it'll be interesting to see how the powers that be navigate this. But when you read in between the lines of what this guy's saying in this article, mandates are incoming. And this guy, he doesn't just want you to have to download the contact tracing app. He also wants you to have a QR code attached to you that will, of course, be your QR code for the rest of your freaking life and after. Even though I'm sure they say they destroy it, that QR code is going to be assigned to you. Just infantile them. Just get used to it. They add things, they don't ever take them away. So he wants these QR codes so that we can get scanned as we're trying to go in the grocery store if we're not following app-mandated isolation. I don't know what to tell y'all. I was calling them health tracking and restriction apps. They call them contact tracing apps. Contact tracing was something that they got together during the AIDS epidemic. Why? Because when somebody was like, you've got AIDS, can you tell me the people you've had sex with in the past 3 months? It is a very easy question to answer. But when you walk up to somebody and you say, hey, you got the CV, tell me everybody you've been within 6 feet of for the past 2 weeks. What the hell are they even talking about? Why are there even people being paid to do that? It's crazy, man. So yeah, contact tracing, something that only really works with like a slow mover type of disease. Nobody remembers enough people that they were within 6 feet of within a normal day where you're out and about to where they can actually give you that information. And so what do they want to do? Well, they want to take that information. So they want your phone to go off when you go inside of Wegmans. And then when you get the CV and you're in Wegmans at 3 p.m., if I'm Johnny Come Along Lately and I'm at Wegmans, but I'm a mile away from you over at the milk section, well, guess what? Both of our QR codes scanned us into Wegmans at the same time. Guess what, buddy? Your QR code's going to turn red. You're going to have to go sit it out at the house. And now they don't have to ask the guy, hey, who did you stand close to at Wegmans? They don't have to ask him that. Contact tracing isn't effective that way. It's not going to work. So what they're going to do to get around it is they're just going to put red QR codes on everybody that was at Wegmans at the same time he was. Put red QR codes on everybody that was at the movie theater at the same time he was. At the gas station. If you were there and his phone pegged off your phone and your phone pegged off their phone and one of you tests positive for the CV, and don't get me started on testing, but one of you tests positive on the CV, you guys are all going to be sat down. And that is what they did in Wuhan. When I reported on that, there were citizens saying, I am not sick. I've not been exposed to anything. I have no idea why my phone says red. I don't even know what that means. I don't know how the government comes to this conclusion, and I'm not allowed to move. And I was like, yikes, that's scary. But it is not scary to Zach Doffman. Zach with a K. I don't know, you guys. It seems like it's lining up to be that way. The mask, the apps, and the vax. And it's all peer pressure. It's all social pressure. It's all making you feel guilty about not keeping grandma safe. And it is all BS. Later.